substitute, is that right?
Mr. Chairman, I would ask you all to adopt the substitute.
Very good. Well, we'll do that and we'll get information on what's in it. So there's a motion to second that the substitute be adopted. All those in favor say aye. Aye. Those no, the substitute is adopted. So, Senator Hanger, why don't you give us what is in the new substitute as drafted, and we'll consider that.
Thank you, Mr. Chairman. Just the essence of what we're trying to accomplish here. We have an expert advisory panel that we've been working with our mental health commission, and one of the chairs that's been involved with that is a professor at the University of Virginia Law School, and he helped us develop this. There is an issue with sharing of information for court proceedings, and the Supreme Court has determined that there was at least some lack of clarity, and that we would need a statute change for them to be able to share information, which would be used for a lot of reasons. But I think the essence of the substitute are some concerns that have been raised by the Supreme Court, and I think they could more adequately address those than I could, as far as the safekeeping of information and who would be doing what. So, Mr. Chairman, if you wouldn't mind, I would have the representative explain that.
Sure. Welcome back.
Thank you, Mr. Chairman. The bill as it was originally drafted was overly broad. It would require the courts to send their records on these mental health proceedings to DDHDS, and it was both electronic and as written it would have been their paper records. And our understanding in working with the department and with Professor Bonney is what they're looking for are electronic records, statistical information that they can use to do analysis on need and to improve the system. And so the substitute is limited to the electronic records from these proceedings. That would be something that would be maintained in the systems, the case management systems that it would be the district court system that the Office of the Executive Secretary maintains, and we would be authorized then to share that information with the DHDS. Right now there's confidentiality provisions in the code that prohibit sharing of that. So.
Okay, understand. Great. All right, are there those that are also in support, or anyone here in opposition to the bill? Yeah, welcome.
Good morning again. My name is Jennifer Spangler. And I would like to oppose this bill unless there's a strict protocol for who and where this data is shared. I'm a research and data specialist that's done work merging large databases with sensitive data. I work for Virginia Tech, and I merged children's early and medical data with a nonprofit to study kindergarten preparedness and health as it relates to health. It is possible to scrub identifiable data information while maintaining data integrity and correctly matching records. And so as a scientist, I definitely understand the value of researching data as it applies to policy change. However, as a person with a mental health challenge who may very well be in this data set, I feel very uncomfortable with my sensitive information being out there for anybody to see. And the reason why I say anybody is because there are job changes, all sorts of situations where, and you know, is one person going to be seeing this data, 10 people seeing this data? So I just feel like it's very important to put a system in place and really plan this out, so to protect the people who are in this data set. Thank you.
Thank you. So, Mr. Hanger, let me just ask maybe you or the Supreme Court, the information that is included in the first section includes individually identifiable information, right?
It does. That was at the request of the department.
Is it necessary to have individually identifiable information in section 2, which is going to do research and data and statistical archiving and conducting research. Is that necessary to have personally identifiable information in the research section?
I don't think I'm necessarily the one to answer that as far as how the department would need to use it.
Is there someone here from the department that could give us?
I think that, they had expressed an interest in it to be able to link from the criminal, like from the TDO or ACO, and look at them, the records within DBHDS to be able to follow for their research purposes. We have the records, but I can't speak to their use, what they're going to do.
Did you have thoughts to help us?
Mr. Chairman, members of the committee, I'm Daniel Herr, Assistant Commissioner with DBHDS. DBHDS does not have a position on this bill. To answer your question in particular, with identifiable information, as was mentioned, that does allow us to look at the information from the community service boards, from appropriate criminal justice records and other things that allow us to have a better understanding of where these systems intersect and how services are provided, and to tailor our services and supports to match those needs.
So, just to make sure, you think you need personally individual identifiable information to do your research and archiving and that type of thing on the property?
Mr. Chairman, DBHDS does not have a position on this bill, and whether that is or is not necessary.
Do you have any thoughts about that? Well, this data is very sensitive information.
It is, and it was, with the revision, the intent was, and I think, in my opinion, that we've captured the essence of that, that the department should take necessary steps to protect the security and privacy of all the information, and there are state and federal regulations that govern that. In this notion, right now we're in somewhat precarious positions. I know the department has not taken a position on this bill, but you'll also, I would point out, they didn't take a position on the first bill that we had. They're just kind of not taking a position on bills in this area. So I would hope that wouldn't skew your thinking.
Okay, so, yeah, maybe I'll work with you and Tom to make sure that it is well covered between now and the floor, and that this bill moves forward. Okay, there's no other amendments necessary on the bill. Then is there a motion on the bill? There's a motion and a second that the bill be reported in the form of a substitute. All those in favor say aye. Aye. Those no, and the bill is reported. Thank you.
Thank you, Mr. Chairman.
Okay. Up next, Senator Parker, if you don't mind waiting a bit, I think what we were going to do is we're going to go to some of the non-member bills, including Senator Corolla bill. We're going to go to the Donovan bill related to some education issues. We've already dealt with one of your bills. So, Senator Corolla, you have Senate Bill 877 regarding hospitals.
Yes, Mr. Chairman, members of the committee, what this bill does is it just removes language that states that women's health centers would have to meet the physical requirements of a hospital. What this bill does essentially is it removes statutory language that the U.S. Supreme Court in Whole Women's Health versus Hellerstedt determined was unconstitutional. And in that ruling, the court said that a state must demonstrate there's actual medical necessity, evidence-based medical necessity for these kinds of restrictions. And then if you do have that evidence, those restrictions have to be weighed against the real-life burden it places on a woman to access her constitutionally protected right to a safe and legal abortion. All this does is just remove the language that the U.S. Supreme Court has already ruled unconstitutional. That is the beginning and end of my bill. There are people who would like to speak to it. so you probably understand it.
We understand it pretty well. People that want to speak for or against the bill. Okay. So what we'll do is we'll maybe just load up the clock and we'll let each side have about 5 minutes each. And we're gonna, since it's straightforward, we're gonna just do that, and then with the concurrence of all of our members.
Before this, we just ask the paper and go to questions.
Yes, but if you guys would start preparing the 5 minutes, and we'll have those in favor first, those opposed, and then we're gonna vote. Senator Carrico.
So, with the bill being here before us, what is the status of the review of the standards that we currently have that was ordered by the governor?
Thank you. I meant to say that. I was going to say in my closing remarks, in October, the Board of Health did vote to reverse regulations that had been in place that actually had allowed these restrictions. So the Board of Health has reversed those regulations. Thank you, Senator Carrico, for asking that. I had that as a note.
So has the governor, it's been a couple of months now since that review was recommended. Has the governor did anything, any actions in those 40 days?
Not since the Board of Health reversed the regulations to conform to the U.S. Supreme Court. The governor has not taken any action.
So the governor hasn't taken any action?
Negative.
So what is the urgency for us to do something as a general assembly?
Well, I want to bring the code into conformance with the Supreme Court ruling. We bring the code into conformance when we get other Supreme Court rulings. I just want to bring the code into conformance. Again, it's following federal law.
Senator Carrico.
I think that kind of answers, I know the bill is before us, I know the governor asked for some reviews of those standards, and you're saying those standards were brought to his attention in October, yet he's not acting, but we're going to act prior to his act.
I don't see any reason why we wouldn't act. We're under the federal law. I don't see any reason to not remove the language. The flip side of it.
Very good. So with that, if those that are in favor of the bill would come forward, and we will start a 5-minute clock, and then we'll have some of those people that are in opposition to the bill. I'm going to set the clock here, and you'll be able to see your time. Welcome.
Well, thank you. Mr. Chairman and members of the committee, good morning. My name is Janice Kraft. I'm the Policy Director for NARAL Pro-Choice Virginia. I ask that you support Senate Bill 877. Healthcare providers in Virginia, including abortion providers, should be subject only to those laws and regulations that legitimately advance patient health and safety. The Virginia law requiring abortion providers to be regulated as hospitals is not, and never has been, justified by medical necessity. It serves only to burden women by limiting access to safe, legal abortion. Please ensure that Virginia women have timely and safe access to the high-quality reproductive health care they need, and support Senate Bill 877. Thank you.
Thanks for coming. Welcome.
Good morning. My name is Gail Dady. I'm an attorney for the ACLU of Virginia. And as Senator Favola mentioned, in the decision Whole Women's Healthy Hellerstedt, the Supreme Court struck down a Texas law that regulated abortion providers like hospitals and reaffirmed a woman's constitutional right to access abortion. Clarifying the undue burden standard established in Planned Parenthood v. Casey, the court held that to be constitutional, an abortion restriction must have a proven, evidence-based medical benefit, and that medical benefit must outweigh the real-life burdens it imposes on a woman's ability to access abortion care. So, in other words, it's not enough for a state to claim an abortion restriction benefits women's health, they must prove it. And in Virginia, there is not, and has never been, a proven, medically justified reason for regulating abortion providers like hospitals. Until 2011, abortion providers and their practices were regulated like other physician groups and their practices. With the passage of Virginia's TRAP statute in 2011, abortion providers, and only abortion providers, were singled out for targeted, politicized regulations and restrictions. Since then, the number of women's health centers in Virginia has shrunk from 21 to 14. 92% of Virginians live in a county without an abortion provider. Track laws have only one aim: to prevent a woman from accessing abortion by shutting down women's health centers, preventing physicians from performing abortions in their offices, and preventing new women's health centers from opening. There is no proven reason grounded in patient health and safety that the Virginia law should require abortion providers and no other physician group or medical office to be licensed as a category of hospital. As you all have heard many times, first trimester abortions are one of the safest medical procedures